Hey, good evening to everyone. My name is Dr. Mohit Joshipura. I am the Chief Medical Officer of Open Loop Health and also a board certified internal medicine and obesity medicine physician, uh, giving you the following information on behalf of XMD Wellness. So, it's really my pleasure to be speaking with you all today and giving you some information about GLP-1 and GIP medications, which have, as you might be aware, taken the medical world by storm in the last 2 or 3 years. And the enthusiasm in the medical community, but also in the patient community and the pharmaceutical community for these classes of medications is justifiable because the literature shows that there are significant benefits to these medications that I'll go into here shortly. And in most cases, benefits that outweigh the risks in a variety of different populations, and benefits that really go beyond weight loss is what we're finding out. So I'll go into some detail about what these medicines are, how they should be taken, what the benefits are, what the potential risks and side effects are, and in which situations they are most beneficial, and really different ways of taking them in terms of dosages and indications. So to get started, what are GLP-1 and GIP medications? So actually, GLP-1 and GIP are hormones that your body actually makes in the intestine, and these hormones are released after you eat a meal. And the purpose of these hormones is to help control blood sugar, slow your digestion down, and have your gut actually tell your brain that you're full. These medications are actually what we call agonists of these hormones, meaning that they accentuate or mimic the function of these hormones to do the same things that we are talking about. Popular brand names for these medications are Wegovy and Ozempic for the chemical name semaglutide, and Zepbound and Mounjaro for the chemical name tirzepatide. As I said, these medications mimic or boost levels of those natural hormones. They help people feel satisfied sooner and therefore eat less. Studies done on Wegovy show up to a 15% weight loss, and studies done on Zepbound show up to a 21% weight loss at higher doses of these medications over a span of 68 to 72 weeks. And this is aside from these medications actually being anti-diabetic and controlling and improving blood sugar. In fact, the first GLP-1 medication was approved in the United States in 2005 as a diabetes medication, and it's only been relatively recently that they have gained popularity as medications to assist with weight loss. As I said, established benefits beyond diabetes management and weight loss include cardiovascular risk reduction in patients with established cardiovascular disease. I think this part got cut out, so my apologies. But also slowing down the progression of kidney disease, improvements in fatty liver, and also in the case of Zepbound, obstructive sleep apnea is now an official treatment indication for Zepbound in conjunction with other sleep apnea treatments such as CPAP. Um, Emerging research, which is research that is coming out but has not yet been fully borne out and is not yet an official indication, indicates that these medicines may have potential benefits with regard to reducing inflammation, such as in conditions like inflammatory bowel disease, psoriasis, rheumatoid arthritis. They might help with cognition in certain states like Alzheimer's disease, and also potentially might positively impact addiction pathways in the brain. And so this research is incredibly fascinating. Of course, it is still being borne out. These are not official indications for the medicine yet, but it is incredibly encouraging in terms of what these medicines can potentially do beyond helping with diabetes and beyond helping with weight loss. And I think we're just scratching the surface in terms of their potential benefits for us. One of the main questions that is asked and should be asked is, are these medicines safe? The common side effects of these medicines are largely gastrointestinal in nature, nausea being the most common side effect, seen in upwards of or up to 30% of patients to some degree. Also see vomiting or can see vomiting, diarrhea, constipation, and abdominal discomfort. These side effects tend to be dose dependent, which means that the higher you go in dose, the more likely you might be to experience one or more of these side effects, both in terms of frequency and severity. However, the good news is, in many cases, given that we know that this is the most important or the most common set of side effects that we experience with these medications, we have both pharmacological ways and lifestyle methods to kind of alleviate these side effects and even be proactive with how we manage them. So patients are able to more effectively remain adherent to therapy and reap the benefits of being on this medication, which, as it stands right now, is really intended to be something that you stay on for quite some time. Less common side effects of GLP-1 and GIP medications include pancreatitis, which is inflammation of the pancreas, gallbladder disease, kidney injury, which usually is a byproduct of fluid losses, whether it's due to the previously described gastrointestinal side effects, intestinal obstruction, which could be because your GI tract has slowed down, and then low blood sugar, which is not as common as some other diabetes medications. In GLP-1 and GIP medications, the low blood sugar is often seen when they are used in combination with other blood sugar lowering medications that could result in hypoglycemia or low blood sugar. And these medications have the potential to worsen diabetic eye disease or diabetic retinopathy, especially in patients who have this established as a diagnosis. Now, there is a boxed warning on these medications. They are contraindicated in patients who have a personal or a family history of medullary thyroid carcinoma, a particular type of thyroid cancer, and or multiple endocrine neoplasia type 2, which is a syndrome of conditions and cancers, one of which, and tumors, one of which is the medullary thyroid carcinoma. And while these studies and risks have been borne out in rodent or rat models, while we don't have strong human studies corroborating these risks, obviously the risks of this particular situation likely outweighs the benefit, at least at this moment in time. And so any patient with this medical history, personal or family medical history, should not be given these medications. In terms of best practices, I always say that these medications are an important tool that is part of a bigger toolkit. And that's one of the points I've made down below. And they're not intended to be a panacea. That's probably one of the most important things I'd like for you to take away from this. It's not intended to be a cure-all, but it is intended to be used alongside an improved lifestyle in order to focus on long-term weight loss that is sustainable and safe. So to begin with, it's important that you fully and exhaustively evaluate the patient's medical and medication history. It's important that you start at low doses and titrate patients individually to what might be the best dosing level for them that balances effectiveness and side effects. Obviously, monitoring their weight closely and managing side effects. Checking labs. Labs are not a universal requirement in all patients, but it is certainly recommended for all patients and becomes incredibly important in higher risk patients, such as those who might have kidney disease or liver disease. Those who are diabetic are example, and those who have uncontrolled blood pressure would be examples of patients where labs become even more important to monitor and check initially. counseling patients, as I said, that these medications are a tool in the toolkit as part of a toolkit, and they really are not intended to be a kind of a medicine that you take without adhering to certain lifestyle measures that are equally important to sustain your weight loss journey. And as part of those lifestyle measures, one of the most important things for those aspiring to lose weight is a focus on a calorie deficit as part of your meals, focusing on a nutrient-dense, high protein and high fiber diet, focusing on smaller and more frequent meals, which to an extent might happen naturally because if you recall, I said a few minutes earlier, these medicines help you feel fuller sooner than how full you might feel if you were not on these medications. Resistance training for muscle preservation is something I want to highlight as well, because when you lose weight, it's impossible to control how much of that weight is coming from fat loss versus muscle loss. And almost inevitably, you lose some of both. And to maximize fat loss and minimize muscle loss, one of the things that becomes important, two of the things that become important are, as I mentioned, a high protein diet and resistance training or strength training for muscle preservation becomes incredibly important as well. Now, movement is a highly underestimated tool for fat loss. It could be something as simple as steps, does not have to be by any means high intensity cardio. Hydration becomes incredibly important to keep your kidneys healthy while on these medications to potentially minimize fluid losses and potentially mitigate some GI side effects. And also, hydration can sometimes help you or prevent you from overeating in some situations as well. And in many patients, formalized dietetics and behavioral therapy support is incredibly important alongside some of these other approaches to losing weight. And it's always important to individualize therapy to each patient and set expectations with them regarding the medication timeline. This isn't something that is going to magically cause you to lose pounds on a scale overnight. It often takes multiple weeks to start seeing impacts on the scale. And as it stands right now, what we know is that these medications are intended to be part of an overall plan, medically managed and medically supervised plan to lose weight. And there isn't a finite or arbitrary time that we can say you can start this medicine today and stop it X number of days, weeks, or months from now. That remains to be seen and is individualized to each patient and their goals and how they react to the medication. As far as we know, these medications are intended for potential long-term use in many cases, especially given that obesity is a complex and chronic disease state. Okay, and finally, what we are more familiar with and what I've talked about probably more in this conversation is what's on the left of screen right now, which is the use of GLP-1 and GIP medications for weight loss, which is a kind of a tiered approach and uses conventional dosing and is in our protocols is for BMI, those who are overweight, so BMI 25 to 26.99, as long as they have a weight-related comorbidity, or for those who are BMI 27 and up. The primary intent of these programs or this program is weight loss, while also the potential assistance with other approved scenarios such as diabetes, cardiovascular risk reduction, slowing kidney disease progression, the improvement of fatty liver, and sleep apnea treatment, as I mentioned in my previous slides. But there is also an emerging and evolving use of this medication, but which is not borne out by randomized controlled trials and is not an officially approved indication for this medication, but one that is in the medical community gaining traction for a variety of different reasons. And it's called microdosing. And microdosing is a much lower dosing of these medicines. I know it says 50% of conventional dosing here, but in many cases it's actually below. It's actually 50% of level 1 dosing is where this starts. And so that's important to to know. And the primary intent here, this is something I want to clarify. The primary intent for microdosing is actually not weight loss. Even though you might see a little bit of weight loss with microdosing, it is not for those who need or want weight loss as the primary goal of taking these medications. And that's why you see the BMI standards for microdosing are lower than what they might be for GLP-1 and GIP use for weight loss. And they can be used in our protocols for BMI 20 plus. They can be used in folks who are mildly overweight, BMI 25 to 26.99, if they lack a comorbidity and therefore are not eligible for conventional dosing, and can be used as a technique to maintain weight. Those who are seeking kind of other benefits of these therapies that relate to improving insulin sensitivity, managing appetite, managing inflammatory states and inflammation, cognitive support, and things of that nature, which I discussed as kind of non-weight loss, non-diabetes benefits that are emerging in the literature with regard to GLP-1 and GIP medications. So I hope this was beneficial to you, and I've tried to in the last few minutes kind of provide a high level overview about these medications, what they're used for, how they should be dosed, and probably most importantly, trying to hone in on the message that they are a great tool, but are a tool that should be used as part of a broader toolkit geared towards safe, sustainable weight loss. So again, thank you very much. I hope this helped, and wish you the very best.